Leader of Third Party.
Thank you, Honourable Speaker. And I want to start by saying I absolutely support taking every effort to minimize the fatalities associated with COVID-19 and the evidence-based response to prioritize the vaccination of elders. I also think there's room in the discussion, especially with the recent approval of the AstraZeneca vaccine, to consider not only years of life lost, but years of life limited by the long-term health impact experienced by some COVID-19 patients. As the head of the Centre for Post-COVID Care in New York has estimated, at least 10% of COVID-19 patients end up developing chronic symptoms. Most long-haul patients are women, relatively young, and many only experience mild illness when first infected. Added to that, recent data from the UK suggests that roughly 15% of kids under the age of 16 have at least one lingering symptom 5 weeks after their initial diagnosis. My questions for you, Honourable Speaker, is to the Minister of Health, and the answer can be short and hopefully sweet. Is his ministry collecting data about long-term COVID illness experienced by British Columbians, and if so, where is the information being posted for the public?
Minister of Health.
Thank you very much, Honourable Speaker. The member will know, and I appreciate her question, the member will know that this subject, the issue of the impact of COVID-19 as long-term impact, is at the center of our responses. We have many centers of excellence that are supporting people who are addressing COVID-19, and the point she makes is an important one in terms of both immunization and in terms of the future of the pandemic, that this pandemic has had a profound impact on people's lives, those who've lost their lives, those who've got sick, and those who continue to deal with that. And so those issues and how we deal with those issues is something that has been repeatedly reported on and answered to by Dr. Bonnie Henry in our public briefings, and we'd be very happy to set up a briefing about those with the honourable member so she can get a sense of the actions we're taking in support of people who are dealing with the long-term effects of a pandemic and of a virus that can have deep impacts on people of all ages.
Leader of the Third Party.
Thank you, Honourable Speaker, and I do look forward to a briefing, and I will ask in the briefing again about the collection of data around people who are experiencing these long-term symptoms and where that data is publicly available. As reported in the New York Times COVID long-haul patients report, a stunning array of mysterious symptoms: fatigue, pain, insomnia, memory problems, brain fog. And this should, as the Minister points out, raise important questions for how we organize our COVID policies in BC, which professions are prioritized for vaccination, and the level of risk we are expecting frontline workers to take. Younger people may be less likely to die, but the long-term impacts from this virus are not always trivial. For healthcare workers and teachers, who have the highest number of WorkSafe BC COVID claims, respectively, as well as the 12,000 plus recorded cases for children and teenagers, this is particularly worrying. My question again is for you, Honourable Speaker, is to the Minister of Health. How is the Minister accounting for long COVID in decision-making, and how is he preparing to support long-haul patients, both medically and in the event that they are unable to work or go to school while navigating a long and uncertain recovery?
Minister of Health.
Well, as the member will know, that we have established 3 specialty clinics in British Columbia to address the needs of people who are dealing with ongoing effects of a COVID-19 infection, and that effort, which is a significant effort in our healthcare system, is something that's been ongoing for some time. I'd be happy to brief the member on it. The member talks about immunization clinics and the decisions that will be made. We've made it very clear from the beginning, from December in our briefing, then January in our briefing, and then this week in our presentation about immunization plans. But the focus of our effort is to deal with those who are most vulnerable. So long-term care was first, then assisted living. Rural and remote Indigenous communities had high priority in that. Healthcare workers who serve those who are most vulnerable have been very substantially immunized. And that reporting we've done consistently. Our plan for the coming months was laid out on Monday, and again focuses on an age-based approach, but also includes those with specific needs who are not age base, including those, for example, with developmental disabilities. With respect to the AstraZeneca vaccine and potentially the Johnson & Johnson vaccine, we are doing modeling based on the evidence. And these are how the reports and recommendations are made by the BC CDC and Dr. Henry, based on the evidence of what would have the most positive effect both on the outcomes of people and on the outcome of the pandemic in British Columbia. And so that review and that ongoing review will guide us as we use potentially other vaccines. Could it be AstraZeneca or Johnson & Johnson or others? So these are considerations. Everything we do is based on the evidence. Every person who is immunized is followed in their immunization path. Every person who tests positive for COVID-19 gets support and is involved in contact tracing and follow-up support. And that effort will continue based on the evidence in BC and led by our extraordinary team of public health professionals.